The cold and flu season is just around the corner. When illness strikes students living away from home, the students can even be a little bit more difficult to deal with the season. This week on Live, Teresa Johnson talks with Rachel Svartoien from Student Services about the benefits and options students have when they're feeling under the weather.
Many USD students don't know this, but Student Health Services are there for them. One of these services is the flu shot clinic that is taking place tomorrow. Rachel, can you tell me a little bit about this flu shot clinic?
Sure, Teresa. We're actually having a flu shot clinic here on campus. It's going to be held in the Wellness Center from 5 to 7 tomorrow. If you're 18 and under, the flu shot's actually free. It's provided by the Department of Health. Otherwise, it's $20 for the injection and $25 for the mist.
Okay, and how does this compare to getting a flu shot at a clinic?
Sure, if you actually go to Student Health, the rate is $31 for the injection or $52 for the mist. So we do offer it at a significantly reduced price by coming to this event.
Okay, and can you tell me a little bit about Student Health Services in general, kind of how it works?
Sure. Student Health basically is a discounted service for students. It's part of your general activity fees, so you're already paying about $50 a semester to use Student Health. The big thing that we like to stress about Student Health is that your office visit is free. So that typically is about $130 just to go to Student Health, and from the fees that you pay, that office visit is free. All the other services are either at a no cost or a reduced fee. A common one is like a strep throat. Let's say you have a really sore throat and you wanted to go check it out, see what it was. Just to do a rapid strep, that's actually free at no charge. And if you need to do a culture, a swab, that's $5. So, I mean, normally that probably costs you $60 just to get that test done. So it's a benefit to be a student and get those reduced prices.
Okay, and what would you say to the students who claim that if they go to Student Health Services, they will be served at a slower rate than regular patients?
I would actually disagree that. It is true that Student Health is at the same clinic as the normal community. So you could be sitting by a pediatric and you could be sitting by your grandma. It just kind of depends on what doctor you're probably seeing. Some of our doctors have a really big schedule and see a lot of community patients. So it just depends. If you're there for maybe just an immunization or a titer, that's with the float nurse, so just kind of when the nurse can get you. So it's kind of perception. I don't believe that students are treated any differently than the community members.
Okay, and how many students usually utilize the Student Health Services?
It's usually significantly increased during the school year. Right now, I think last month we saw about 700 students. The highest we see is probably about 950 students a month. Of course, it decreases during the school year, or during the summer.
Okay, well, thank you very much. Back to you.